Welcome to the Hormone and Weight Loss Masterclass. You're in the right place if you are looking for answers to questions about HRT, weight loss, GLP1s, and more during perimenopause, menopause, and afterwards. And so questions we're going to be answering today are things like, is HRT safe? How do you get better sleep? What are risks and benefits of taking a GLP-1 medication? And in case you don't know us, my name is Sarah Gibson. I'm a master's degree physician associate with over 20 years of experience. I'm trained in both traditional and functional medicine, and I'm also a certified health and wellness coach. I also have a certification in lifestyle medicine, which uses food and nutrition to reverse chronic diseases. And I'm here with my co-founder, Abby Walsh. She has her master's degree in nutrition and is a certified nutrition specialist, which is the most advanced certification for personalized nutrition practitioners. She spent the last 17 years helping women balance hormones and lose weight naturally. And so together we've come together and formed a company called Vitality Health Matrix. We've helped thousands of women balance hormones, lose weight, and feel like themselves again using the Matrix method. And so we're going to go over some of those things today. We've also been speaking nationally on stages across the country, talking about menopause, perimenopause, and advocating for women's health. We have been featured in global publications, multiple news channels, and different journals, and also have recently released our #1 bestseller in multiple categories, Empowered Weight Loss, and it's available on Amazon. We're also associate producers on Balance, a 4-part docuseries that was picked up on Amazon Prime and Apple TV, alongside top experts like Mary Claire Haver, Dr. Heather Hirsch, and Dr. Vonda Wright. And so you'll recognize a lot of these experts advocating for menopause health. How did we get here? Well, when I was growing up, I was an athlete and I had no problems losing weight. I was healthy and I knew how to control that number on the scale when I did the right things. And so here's a photo of me, age 25, on my wedding day, feeling great, feeling healthy, and feeling confident. Fast forward 10 years, I had 4 children in 4 years. I was working a high stress medical job in trauma and critical care, and I was working night shifts. So I was very stressed and overwhelmed. And I found myself 60 pounds heavier than I ever had been. And I also was pre-diabetic. I had elevated blood pressure. And so when I finally got my head above water, I thought, okay, now it's time to get back to basics, focusing on my health, doing all of the things that I knew what to do in order to control that number on the scale. And so since I have children, I was trying to set a good example for them by exercising with them, by meal prepping, and making it fun. But on the inside, I was really embarrassed and depressed because my efforts just were not matching my results. I was doing all of the right things. I was eating better than I ever had before. I was exercising consistently, and just that number on the scale wouldn't budge. And so I went to my traditional doctor, as many of you have done, and I said, hey, I think something's off. I don't feel well. Can you check my labs? And he said, everything's fine. Your labs look normal. This is just what happens as you get older. You're just a stressed out, busy mom. And so, of course, I took that to mean that it was my fault, that it was a lack of discipline and I just needed to work harder. And so I thought, all right, I am going to do more extreme disciplined work. And so I actually trained for and ran a full marathon, 26.2 miles, and I only lost a couple of pounds. Then I did a 17-day medically supervised fast, which was nothing but water and electrolyte salts, no broth, no protein, nothing. And I only lost 3 pounds. And that's when I knew something was significantly wrong because I thought, there's no way for me to exercise more than running a marathon. There's no way for me to eat less than water. How am I going to lose this weight? And I could either give up and just assume that this was my new normal, that I was going to be overweight, that I was going to struggle with my self-confidence, that I wasn't going to feel like myself, that I was going to continue to have my health decline, be diabetic, have elevated blood pressure, be on medications, or I could do what I do best and dive into the research. And it did take me 6 years of trying to figure things out and being my own case study. But what I discovered are things that we're going to talk about today, that there are actually 5 hormone imbalances that directly impact your ability to lose weight, especially if you're over the age of 35. And once I figured out what those imbalances were, I discovered this thing called perimenopause and menopause. And I was actually able to test my own labs. I was able to figure out that I had all 5 imbalances. And once I knew what was going on, I could focus on healing that root cause of the issue. And so once I did this, I was able to lose 60 pounds in 8 months and also reverse my prediabetes and get off of blood pressure medications. And so now I show up as the best version of myself, as a great example for my kids. I feel great. I don't worry about that number on the scale because I know the things that I need to do to balance out my hormones and stay healthy. And I'm actually eating more and exercising less than I ever did when I was trying to lose weight. So this is not only something that I've done in my own life, but then I quit traditional medicine and started a medical practice where I started doing these exact same things for women like Shannon, who was a D1 athlete in college. She struggled with her weight after having kids, and using the matrix method, she was able to lose 26 pounds and regain her confidence. I love this picture of her. Lori is whose husband is a personal trainer, and she gifted working with our team for her 50th birthday. She was able to lose 45 pounds, and she loved the experience so much that she actually joined our team as a health coach. And we have Rose, who is in that sandwich generation of caring for her mom while trying to launch her young children out of the home. And she hates to work out, but she knew that everyone was relying on her. And so she really had to focus on herself. And so she did our program, and in less than a year, lost 85 pounds. She's feeling young, energized, and confident, and feels like the best version of herself. And so I know that it's frustrating that we can't lose weight as easily as our male counterparts. So if you've ever had a time where you try and go to the gym with your spouse or your brother and they change just a few things in their diet and within a week they're down 15 pounds, well, it's not because of lack of discipline or they're doing things differently. It's because of biology. And so women are not just smaller versions of men. Biologically, we're created completely differently, and we're created to grow the population. And it's a huge metabolic demand to get pregnant, to carry a baby successfully to term, to deliver that baby, and then nourish that baby with our own bodies afterwards, even sometimes up to years. And so men, by the way, don't have that metabolic demand. It's just a quick one-time deposit, right? And so, since we're wired that way, if you look at the research, data shows that women who are legitimately starving, who get pregnant, have a very high risk of death, both to themselves and to the babies. And so, if we're the ones that grow the population, have a huge metabolic demand, and at a higher risk of death if we actually get pregnant and are starving, well, then it makes sense that our biology is different because we gain weight more quickly, we lose weight more slowly, and we have more intense hunger cues than men do. And so, why would we do the same things that men do to lose weight, right? It just doesn't make sense.
So we get asked all the time, I'm doing nothing different. In fact, I'm eating better and I'm exercising more than I ever have before. Why can't I get the scale to move? What is happening in my body? My name is Abby Walsh. Like Sarah shared at the beginning, a little bit of my story is I grew up active as well. I was a dancer. I owned my own boutique gym. I taught so many fitness classes. I was a yoga teacher. I would be working out, 5 to 14 times a week teaching classes. I got my master's in nutrition and I knew what to do, but yet I still found myself in similar situations, which we'll talk about. I watched women at my gym in their 20s and in their 40s following the same plans, but getting different results. And that started to make me question, what do I need to learn differently? How can I be curious to figure out what is going on in their bodies? And this is when I started specializing in hormone health. I healed my own body and I helped thousands of women do the same. So we're going to talk about a few of the reasons why we can be doing everything the same as we have in the past, but we're no longer getting the same results. And one piece of this is muscle sarcopenia. This is the loss of lean muscle. Women lose 3.5% of lean muscle per decade of life after the age of 30. And why does this matter? This matters because 1 pound of muscle burns 9 calories a day, where 1 pound of fat only burns 5 calories a day. And you might not think that that seems like a big difference, but when we do the math together, it really does. So let's talk about a case study. This is Kathy. She's 25 years old. And if we use a basal metabolic rate calculator, which you can find online anywhere, you put in your age, your gender, your height, and your weight, and it calculates about how many calories a day you burn at rest, not due to exercise, but just being breathing and your organs being able to function to be alive. You burn this many calories a day. So Kathy's 25 here. She's female. She's 5'6" and she weighs 160 pounds. She would burn 1,487 calories a day at rest. Now let's not change anything except Kathy's age. Now Kathy is 45 instead of 25. Nothing else has changed except her age. She's aged 20 years. She's still female. She's 5'6". She weighs 160 pounds, but now she's burning 100 calories less per day, only 1,387 calories. Now you might say only 100 calories. What does that mean? Why does that matter? 100 calories a day, 30 days in a month, 12 months in a year. There's 3,500 calories in 1 pound. So doing nothing different at all, just aging by 20 years and now burning 100 calories less per day, Kathy could expect to gain 10.28 pounds per year. So this is one reason why you might be feeling like you're doing all the same things as you were before. You haven't changed how you were eating. You haven't changed how you were exercising, and you're gaining weight. And if you haven't gained weight and you're maintaining your weight, but you know you're trying harder and harder and harder, I want you to applaud yourself already, because you are trying to keep up and you're doing great, but maybe you're still not feeling well and you want to be able to move the scale. Let's talk about the other reasons why the scale is becoming more difficult to change. So, are you in perimenopause? Are you in menopause? Why are we gaining weight if our habits haven't changed? So, let's define a few things together as we talk about hormones, perimenopause, and menopause. So, premenopause is the time from when we get our period the whole way until we start to get symptoms leading up to menopause. Menopause is simply one day in time. It usually happens between the age of 40 and 58, most commonly around 51 or 52. But menopause is simply one day. We mark it in time by saying 12 months without a period, but you don't just stop getting a period and go 12 months without one. There's a period of time, typically 10 to 15 years leading up to that, that we call perimenopause, where symptoms start to present, like night sweats, hot flashes, brain fog, fatigue, maybe irregular cycles start to happen for you. And we have this erratic time where maybe we have a period and then we'll go 3 months without one. And then we get a period again, and then we go 6 months without one. And then we get a period again and we go 8 months. And the clock keeps restarting over and over again until we hit that time where we've had 12 months without a period. We say that's menopause. And now everything after that is post menopause. So, what happens during this time that's creating these changes in our body? So, after the age of 35, estrogen and progesterone start to drop. Estrogen drops 40 to 50% between 35 and 60, and progesterone really plummets, 90 to 99% loss between the ages of 35 and 60. And as these sex hormones, progesterone and estrogen, decline, we have metabolic changes happening as well. Cortisol goes up, which is our stress hormone. Insulin resistance goes up, which is how we're going to store fat, burn fat. And we'll talk about that more in just a few minutes. But not only do these metabolic changes happen, it also impacts many of our body systems. The lining of our gut thins as estrogen declines. We're going to experience more inflammation, joint aches and pains, bloating, rashes, migraines, autoimmune diagnoses. Our thyroid is impacted. We might be experiencing brittle hair and nails, cold intolerance, low energy, fatigue. And there's estrogen receptors all through our body, and in our brain, we might be experiencing brain fog. So as these hormones decline and we have metabolic changes, we're going to store fat differently too. And we start to store fat a lot more like men do, around our midsection, around our hips and thighs. Think about that tire around your belly. And not only does that fat distribution change, but we also gain more fat deep around our organs. And that is the scary fat. We call that visceral fat in the body, which can lead to a lot of metabolic disease. So, like Sarah shared in the beginning, we believe that there are 5 hormone imbalances that are really preventing women from losing weight in midlife. And those are vitamin D deficiency, thyroid dysfunction, sex hormone imbalance, adrenal fatigue, and insulin resistance. So, we talked about our book, Empowered Weight Loss, and we talk through each of these different metabolizer types, and we're going to talk through them with you here today. And I'm going to read a little excerpt out of our book to describe a scenario that you might resonate with. And then Sarah's going to go into the biology of what's happening, and we're going to answer some questions that we know that you have through helping so many women. So the first is insulin resistance. We call this the locked metabolizer. So you're eating less than you ever have before. You're at the gym 5 or 6 days a week, and the scale is still climbing. And even when the number on the scale stays the same, your body composition is changing. Weight starts to be stored around your middle, creating a thick spare tire that makes every pair of pants feel too tight. An hour after lunch, you crash so hard that you can barely keep your eyes open. The cravings are relentless, demanding, impossible to ignore. You're starving an hour after you've eaten a full meal. You go to the doctor desperate for answers, and you're just told your labs are fine. Just eat less and exercise more. But you're already doing that. You're doing everything, and it's still getting worse. What they didn't tell you is that your cells are locked. Glucose can't get into them to be burned for energy. It's trapped in your bloodstream, getting converted to fat and stored around your organs. Every meal, even the healthy ones, are getting stored instead of burned. Your metabolism isn't just slow, it's locked. What does this mean, Sarah?
So the science behind it is that your cells are locked. So when we talk about metabolism, we're talking about the way that your body takes any different types of energy. So it can be fat on your body, it can be protein, carbohydrates, whatever you eat. It all has to be converted into usable energy, which is glucose. And glucose travels on red blood cells all throughout the body, and any cell that needs energy just raises its hand. So for example, if you're hiking, your little leg muscles are going, wow, she's really putting it to us today, raises its hand and says, hey guys, I need a little extra energy. energy. Insulin is released from the pancreas. It will bind to that cell and unlock a gate so that the glucose can go in and be burned efficiently for fuel. So that's when we say calories in equals calories out, right? The amount of calories that you're consuming is being converted to usable energy and then burned by the body. But when we talk about insulin resistance, prediabetes, and diabetes, it's all the same pathology. It's just different levels of severity. And so everything happens appropriately. It's converted into glucose. It travels all through the red blood cells. But when insulin attaches to that cell, the lock is broken and the gate cannot open up. The glucose cannot go inside and be burned for fuel. So this little cell that said nonchalantly, hey, I need some more energy, now goes into full freakout mode where it drops your metabolism. So you're burning the fewest amount of calories possible. It drops your energy level because if you had more energy, you'd be doing more things, and your body is trying to conserve that energy. And the glucose that you do, in fact, have in your system is immediately stored as fat and mostly around the middle because that's the quickest way for it to be able to be converted back into usable energy. Okay. So you can see that you can't out eat and out exercise a biological issue. So this is where we'll address the root cause of the issue with different prescription medications, maybe supplements, but GLP-1 medications are so effective in this situation because 80% of women going through menopause are going to develop some degree of insulin resistance. And medications have been around for 20 years, right? So we actually do have a lot of long-term data, and people want to know, like, what are they? Are they safe? And so GLP-1 medications are mimicking what your body naturally produces. They will help to slow food leaving your stomach. They will help to prevent those cravings. So if you hear people talk about food noise, it will decrease food noise within your body, and it will help take that glucose and drive it into the cells so that that glucose that is struggling to get inside because of insulin resistance now is being used more efficiently. And that's how we get the scale to move in the right direction. Many women that come to us have been told, though, that they're not overweight enough to use a GLP-1 medication. And so we will microdose even if there's only 15, 20, or 25 pounds to lose. And this is a strategy we've been doing for 4 or 5 years with women. And it's not following the FDA titration schedule. It's just giving you a small amount of the medication and only increasing it if the scale stalls. And so you will get side effects of a GLP-1 medication if you're not using it properly. Things like nausea, constipation, and headaches. And so we have strategies that you can tolerate the medication, times of the day to do it. You can divide it into multiple, injections during the week. So there are a lot of ways to troubleshoot side effects, but most women have side effects when they first start the medication. And then when they jump up on dosing, month 3 or 4 dosing, when you're doubling the amount that you're showing your body, you don't need that much, especially if you're a woman that's going through perimenopause and menopause. And so many people will ask us, do I have to take a GLP-1 forever? And the answer is maybe. So if you're on a GLP-1 medication because you're diagnosed with lifelong obesity, that's a medical condition, and we use medications to treat that. And so if you've struggled way before perimenopause and menopause to control that number on the scale, and you get success with a GLP-1 medication, then yes, you'll probably stay on it longer than most people who are using it just for perimenopausal weight. Okay. But when you do the right things, when you focus on the nutrition and the fitness and reverse hormone imbalance, research shows that you're going to get fantastic results that last, and you can safely wean off the medication. So our approach with our clients is this. We will titrate you very, very slowly and use a microdosing strategy while we focus on the reason that the weight came on in the first place. And then we use advanced techniques like reverse dieting and microtitration to get you off of the medication as well. If you're not following the correct fitness and nutrition plan, you will have things like hair loss, and you can gain the weight back after you stop. So it's not enough just to use the medication to reverse insulin resistance or to lose 10 or 15 pounds. You have to use it as just part of the strategy, as one of the tools in the toolbox.
So now let's talk about the next metabolizer type, which is the burnout metabolizer. This is cortisol dysregulation and adrenal fatigue. I'm going to again read for you a little excerpt from our book so that you can resonate with this scenario. You wake up exhausted despite sleeping 7 hours. You drag yourself through the morning fueled by coffee and willpower. But by mid-afternoon, you hit a wall. Your energy crashes completely. You push through and somehow maybe make it to the evening when you finally have time to rest. But when you lie down to sleep, your mind starts racing. Or you fall asleep easily just to wake up at 2 or 3 a.m. with your brain spinning, unable to fall back asleep for hours. Meanwhile, your waistline is expanding despite your efforts. You snap at your family over minor inconveniences. You feel simultaneously exhausted and wired, depleted but anxious, burned out but unable to rest. If this describes your experience, you're likely dealing with cortisol dysregulation and adrenal fatigue, the second major hormone imbalance that affects weight and well being during perimenopause. This is what we call the burnout metabolizer.
So the reason this is important is because your adrenal glands, they are little tiny glands, they sit on top of the kidney. But as you go through perimenopause and menopause, what ends up happening is that your primary sex organs, your uterus and your ovaries, will stop producing or decrease the amount of estrogen, progesterone, and testosterone. And so this is especially important if you've had a hysterectomy, a total hysterectomy, right? And so the way that the body is designed is that you have the adrenal gland, which is the secondary organ, which will take over for production of those sex hormones. Okay. But the problem is that those sex hormones are secondary to survival. Okay. So the adrenal gland's primary purpose as you go through life is for that flight or fight or flight, right? It's the cortisol regulation. And so if you're chronically stressed, if you're a high functioning woman, you're balancing children, marriage, house, work, all of the things, moving, you have chronic stress your entire life. And those little adrenal glands have been working really, really hard to keep up with that chronic cortisol demand. So as you start going through perimenopause and menopause, and your primary sex organs no longer are operating at a higher level to produce estrogen, progesterone, and testosterone, the adrenal gland is supposed to take over. But the problem is that the adrenal gland produces precursors. So it will produce pregnenolone and DHEA, which will then eventually become progesterone, testosterone, and estradiol. But there's something called the pregnenolone steal. You may have heard of this. And it happens within the adrenal gland that instead of that pregnenolone, that master hormone precursor, instead of it becoming the sex hormones, it is actually stolen and it will follow a different pathway and become cortisol so that your body can keep up with a high demand, right? It's producing more cortisol, but that's where you get that massive gap in progesterone, testosterone, and estradiol. And when we're talking about calmness, we're talking about sleep through the night, right? We're talking about mood regulation. That's progesterone. That's the calming hormone. And so when we're not making progesterone from our ovaries, and then we're not making progesterone secondarily from our adrenal gland, you're going to start getting some of those burnout characteristics. And so common symptoms and questions that we get are things like, how do I get better sleep? Well, we're going to support that adrenal gland. Yes, we want to check your labs and fill in the gap with progesterone, but just getting better sleep doesn't mean a sleeping pill, right? And oftentimes we're going to go to the doctor and that's what we get prescribed. What about testosterone replacement in women? So that's a hot topic right now because testosterone is very important for energy, for brain fog, and for osteoporosis and muscle protection. Okay. But the problem is that there has not been a lot of studies on testosterone replacement therapy in women. So it is not FDA approved. It is scheduled in the class 2 certification of a controlled substance, the same as narcotics, right? And there is no female dosing schedule. And so we say, oh, it's about 1/10 of what men would need. But if you send it to your local pharmacy, it's male preparation. It is male research that we're going off of. And so there is a lot of work that's being done currently. But as it stands, testosterone is not FDA approved, and we can't easily get it through our local pharmacy. Or if we do, we have to work with a provider that knows how to adjust for female dosing. And it has to be highly monitored as well. And so, one way then to support your natural testosterone production is by supporting the adrenal gland, focusing on that precursor, that DHEA, maybe pregnenolone, so that your body can make more of the testosterone that it needs. Because even when you're in your 20s, testosterone's only 25 to 45, and that's when you feel great. That's where you have increased libido, etc. And so it's really important that, we focus on all of the precursors in order to make our own testosterone even before we start replacing it. Now, a lot of times women will say, what type of exercises should we be doing in perimenopause and menopause? And when we're in our 20s, we're going to do things like HIIT classes, high intensity workouts, going for long runs. But all of those things are going to increase our demand for cortisol. And so as we get older, as the adrenal gland starts to burn out, especially if we're having active symptoms, we don't want to layer on more demand for cortisol. So the exercises that are the ones that you should be doing to support your hormones If you don't have cortisol dysregulation, go for it. But if you're struggling with sleep, struggling with anxiety, and you have sex hormone imbalance, you really need to support the adrenal gland and limit your cortisol spikes. And then you may have already gone through menopause. Can you still get help? Absolutely. You don't need all the hormones that you had when you were in your 20s, but you do need some because research more and more, and we'll talk about this more when we go through sex hormone imbalance, but research is showing that you can decrease the following diseases by up to 60% with low dose transdermal hormone replacement therapy. And I'm talking about cardiovascular risk, heart attack, stroke, dementia, osteoporosis, and even certain types of cancers. So even if you've gone through menopause, maybe you don't have hot flashes anymore, hormone replacement therapy and supporting the body naturally is still very important for your overall health.
All right, hormone imbalance 3. And before I move on, I want to pause here for a second because maybe you're already resonating with both 1 and 2 so far with cortisol dysregulation and with insulin resistance. And that is very common for the women that we treat, is that we never see really one hormone imbalance in isolation. All of these work together, and you're going to continue to see that as we talk through this presentation today. So the third imbalance we're going to talk about is the slow burner metabolizer. This is thyroid dysregulation. So back to the book we go. When you walk into your doctor's office complaining about unexplained weight gain, fatigue, or difficulty losing weight, despite your best efforts, one of the first tests ordered is almost always TSH. This is thyroid stimulating hormone. It's the standard screening for thyroid function, and for a good reason. Your thyroid is your body's metabolic master regulator. And when it's not working properly, weight gain and crashing fatigue are the hallmark symptoms. But maybe your TSH came back elevated and your doctor prescribed Synthroid. You've been taking it faithfully every morning. Your follow-up labs now show that your TSH is normal. Your doctor says your thyroid is controlled. Or maybe your TSH came back within normal range and your doctor told you that your thyroid is fine. It's nothing to worry about. But either way, you still feel terrible. The exhaustion is unrelenting. The weight keeps creeping up and won't budge despite eating carefully and exercising. Your brain feels foggy. Your hair's thinning. You're cold all the time. And you feel like you're barely functioning. Yet you've been told your thyroid is fine or it's controlled. Here's what you need to understand. Being told that your thyroid is normal or being on thyroid medication with a normalized TSH doesn't mean your thyroid function is actually optimized. There are critical pieces of information that standard testing don't capture, and these missing pieces are actually why you might be feeling awful. What's going on, Sarah?
Well, we go more into depth in the book, but changes in estrogen and progesterone directly impact the thyroid itself. So, the thyroid is a gland right in front of your throat. And what it does is it takes inactive thyroid hormone, it makes it, it's T4, and it converts it into the active form, T3. And so, the thyroid gland will produce both, but it's about 80-90% of T4, that inactive thyroid hormone that will stay in the body for longer periods of time, and then just a small amount of the T3. And so, women that go through perimenopause and menopause not only start to get atrophy of the thyroid gland, but they will also start having issues with conversion or with receptors. And that's directly related to changes in estrogen and progesterone. But even if you're on thyroid medication, right, you're on Synthroid, Synthroid is inactive thyroid hormone. That's T4. Okay. And so women that are on medication with a normal TSH level, they actually have one of two issues going on if they're still struggling with their weight and with symptoms. Okay. So it's either a conversion issue. You're not converting T4 into that T3, and it can be due to stress. It can be due to changes in perimenopause. It can also be due to an MTHFR gene mutation, which 40% of the population has, and they don't even know it. So if you're given a prescription for T4, but you can't convert it into T3, you're not going to feel well, even though your body's biofeedback is going to say, nope, we have enough thyroid hormone. We don't need more, right? So you can have a normal TSH. You can't convert it, and so you still have the symptoms. Or the second thing that is often misdiagnosed or not even caught at all is that you can have an autoimmune attack, Hashimoto's thyroid disease. As you go through perimenopause and menopause and you get changes in estrogen and progesterone, the lining of the gut becomes more thin and easily damaged. And that gut is essentially just a tube, right? It filters out the bad stuff. It allows you to absorb the good stuff, right? And you eliminate the waste. But the problem is that when that lining of the gut becomes more thin and damaged, things that didn't bother you previously, like stress and alcohol and sugar, now damage the lining of the gut. And the layer underneath, that submucosal layer, has tight junctions that act as a coffee filter, right? And they become increasingly permeable and allow things to escape into your bloodstream that your body hasn't seen before. Now, I'm not saying green beans are escaping, but I'm saying that there are things that are supposed to be eliminated that will trigger inflammation within your body. This is why women are often diagnosed with autoimmune disorders in their 30s and 40s with things like lupus, right? They have multiple sclerosis, they have Hashimoto's disease. It's not because you all of a sudden developed that. It was written in your genetics, and all of the treatments in traditional medicine are towards decreasing the inflammation and controlling the symptoms. But it starts with the lining of the gut because of changes in sex hormones. And so we will often see those thyroid antibodies creeping up in your 30s, in your 40s, but they will be elevated long before they attack the thyroid gland and affect that TSH level. So it's really important to screen for it early on and reverse the damage, reverse the inflammation, and treat that autoimmune disorder before it fully destroys your thyroid gland and is now something that you cannot reverse the damage to. There are a lot of questions that come up around thyroid, especially with GLP-1 medications. So, will GLP-1 medications affect my thyroid? And do GLP-1 medications cause thyroid cancer? So, the research that was out there saying it caused thyroid cancer was faulty. It was only in rats. It was a certain type of cancer, but it wasn't a correlation in humans. Okay, it wasn't causational. And so, this is something that if you have a history of thyroid cancer, if you have thyroid nodules, you just need to have a conversation with your provider, the one that's giving you the GLP-1 medication, so that they can go over the research with you and show you risks and benefits. But if you've had your thyroid removed, guess what? That thyroid cancer risk is off the table. And so GLP-1 medications, if you have Hashimoto's, if you have hypothyroidism, they can actually improve the inflammation. They can reverse the thyroid issues and heal the thyroid gland, even just at tiny micro doses. And so what we have to do is make sure that if you're on a GLP-1 medication, that your thyroid is being monitored, because it will improve. The medication dosing for you will most likely have to be decreased, and some women can completely wean off of it. And so if you still feel bad on thyroid medication, if you're on that inactive T4, that Synthroid, then it's probably because you either have a conversion issue or because you have an undiagnosed autoimmune disorder going on. Now, some providers will give T3 or Armour thyroid or desiccated thyroid, right? And that's because it's the active form. You have to dose it multiple times during the day because it only stays around for 4 to 6 hours. But again, we don't want to do band-aid approaches. So if you have a conversion or a disorder and we can't get you to convert with some of the natural remedies, then yes, we'll do T3, Armour thyroid, and you'll have a combination T3 and T4 medication. But if you are just putting the band-aid approach on it, maybe you have an undiagnosed autoimmune disorder, it's really important to know, why are we doing that T3, right? And reversing the underlying issue before we start layering on medications. And GLP-1s can be used for things besides weight loss. So I have a lot of physician friends that are in rheumatology that will use my same microdosing strategy for decreasing inflammation within the body. It has also gotten new approvals for things like reversing sleep apnea. It helps with dementia patients, and even patients that are on dialysis have been able to decrease their dialysis schedule or even get off of dialysis because of GLP-1 healing properties. So it's a really exciting world out there with all of the new and latest research that's coming out every single day about these medications.
The hormone imbalance number 4 is sex hormone imbalance. And this is the hormone imbalance that everybody calls the hormone imbalance. But hopefully you're already starting to see that there's much more happening in the body in midlife than just sex hormone changes. But it is a big piece of the puzzle. So let's talk about the hormonally hijacked metabolizer. Maybe you're the woman who's been bleeding heavily for years, soaking through super tampons in an hour, passing clots the size of golf balls, feeling utterly exhausted from blood loss. Your periods last 7, 8, or even 9 days. The week before your period, your breasts are so tender you can't hug your kids. You're irritable, anxious, you can't sleep. Your doctor ran some tests, told you everything was normal, and put you on synthetic progesterone to try to control the bleeding. When that didn't work well enough, she suggested a hysterectomy. You're in your early 40s, still having periods, but you feel like your body has turned against you. Or maybe you're the woman waking up drenched in sweat at 3 a.m., having to change your pajamas or your sheets. Hot flashes wash over you without warning, in meetings, at dinner, at the grocery store, leaving you flushed, sweating, and mortified. Your libido vanished. Sex is painful because of vaginal dryness. You forget words mid-sentence and you can't remember why you walked into the room. You feel like your brain's failing you. You're exhausted, but you can't sleep through the night. When you asked your doctor about hormone testing, she said, "We don't test hormones. They fluctuate too much. And hormones are dangerous. You'll just have to get through this. So you're suffering." You were told that this is just what happens to women and you need to accept it. Or maybe you've struggled with hormones your entire adult life. Irregular periods, terrible acne, unwanted facial hair. Maybe you were diagnosed with PCOS. Maybe you had fertility issues. Your doctor put you on birth control pills in your teens or 20s to regulate your cycles and control symptoms. And you've been on them for years, maybe even decades. You've battled your weight the whole time, and now you're approaching going through perimenopause and everything is worse. The weight is even harder to manage. Your symptoms are more severe. You feel trapped in a body you can't control, and no one seems to understand that this isn't a willpower issue or needing to try harder. If any of these scenarios describe your experience, you're dealing with sex hormone imbalance, the fourth of the five critical hormone imbalances that are sabotaging women's health in midlife.
Yep. So this is exactly what people think of when they think of perimenopause and menopause. And because in that 10 to 15 year period before you go through menopause, your estradiol, your progesterone, your testosterone levels are completely erratic. They're all over the place. And so many providers will say, we don't test hormones because they change too much in a 28-day cycle, and even more so while you're going through perimenopause. But they should always be in a balanced ratio. And so we do test sex hormones, and it doesn't matter where you are in your cycle. It doesn't matter where you are in perimenopause or menopause, because we want that nice balanced ratio. And so there's something called estrogen dominance, which is probably the most diagnosed hormone imbalance in perimenopause. And it causes things like women to have a hysterectomy. It causes anxiety, uterine fibroids, worsening anxiety, prolonged periods, fibrocystic breast tissue. So if you've ever been told that you have any of those things, it's not because you have too much estrogen, it's because it's not balanced out with progesterone, just like we talked about when we spoke about the adrenal glands, okay? Or you may be close to or have gone through menopause and you have no sex hormones. And again, you don't need all of the ones that you had in your 20s, but you do need some, not only for your health, but also to reverse the symptoms that you're struggling with: hot flashes, night sweats, low libido, vaginal dryness, even recurrent urinary tract infections. And there are other really weird symptoms of perimenopause, like itching in the ears, ringing in your ears, dry eyes, that people don't even realize it's because there are estrogen receptors all throughout your body. And so questions that come up here are, is hormone replacement therapy safe? What are the risks and benefits of using it? What if I can't take it? So let's talk about some of those things. In 2002, the Women's Health Initiative came out telling us that hormone replacement therapy is bad. This is dangerous. It causes cancer, and it completely halted in traditional medicine our ability to treat you as you're going through menopause. Because if there's nothing we can give you, well, we're not going to be trained on it, right? We're just going to tell you to, grit your teeth and suffer through it because we don't want to cause cancer, right? And there's no other options for you. The problem is that that study was flawed. It was the wrong patient population. The average age was 62, well past menopause. Most of those women already had multiple comorbidities like prior heart attacks, strokes, obesity, and it was the wrong type of hormone replacement. It was conjugated estrogens from horse urine. Okay, that's not even what we use today. And so it caused so much panic that it completely halted medicine for the last 20 years. But over the past 2, 3 years, more and more research has come out. People have said, wait a minute, this can't be true, right? There are so much misinformation, and women are really struggling. So there was a study that came out in May of 2024. It was 10 million women after the age of 65 that continued hormone replacement therapy. Okay, it's a small percentage of women, but they found them. And when they compared them with the general population, those women who continued hormone replacement therapy had decreased risks of heart attack, stroke, dementia, osteoporosis, and different types of cancers, including breast cancer. And research that was published in the Menopause Society guidelines at their national convention in October of 2025 showed that you can actually start hormone replacement therapy 10 years before you go through menopause when you start getting those symptoms, and you can decrease the risks of all of those things by up to 60%. So it stops being a conversation about, is hormone replacement therapy safe? And it turns into the conversation of, can I use hormone replacement therapy? What forms can I use? And can I continue it for my health? What's my family history? And so hormone replacement therapy can be synthetic, which means that it's completely created in a lab. It looks nothing like the hormones your body naturally produces, and it can carry a higher risk of things like clotting. But there are also bioidentical hormones, and you can get those at your local pharmacy. I'm talking about things like estrogen and progesterone, comes in a patch or an oral micronized progesterone pill, but it's derived from wild yam or soy. And now it still goes to a lab, it's still altered and changed, but when you look at it under a microscope, it is almost identical to the estrogen and progesterone that your body naturally produces. So much so that it will raise your serum levels, it will bind to those receptors, and it can even help balance out the other sex hormones, even if you're not on progesterone or testosterone. Okay. So that's really important. Women have been told that they can't take hormone replacement therapy because they have a factor V Leiden deficiency or a clotting disorder or a history of DVT. But if you use transdermal bioidentical hormones, it bypasses the liver. It doesn't increase your clotting risk. And so, knowing the different forms, knowing the different routes, knowing the risks and benefits, and having an educated discussion with your provider is really, really important. And if you're a woman that maybe had breast cancer and you were told that you can't take hormone replacement therapy because of the cancer risk or recurrence, then there are still four other imbalances that you can focus on. And there are natural strategies that you can use to support your adrenal glands, to support your body's own ability to produce even just a little bit of your own hormones. So let's talk about hormone pellets. I get this question quite often. Should I go someplace that uses hormone pellets? Pellets can be bioidentical. They're typically implanted every 3 to 4 months. The problem is that they can't be customized. I mean, you can get that initial pellet customized, but they stay in the body for 3 months. And so you can get a spike of all your sex hormones and then it slowly declines and it cannot make you feel well. Also, with testosterone, you can get testosterone levels into the 300s and 400s, put you at a higher risk, and it's just not what you need. It puts you at a higher risk for deepening voice and male characteristics like thinning of the hair and facial hair as well. And so hormone pellets are an option, but if you go to someone that that's all that they offer you, right, then I would just question that because there are bioidentical hormones that can be prescribed to your local pharmacy and covered by insurance. There's oral tablets, there's transdermal patches, pellets are available, there are creams available as well. And so it really depends on the individual that is using the hormone, what their profile looks like, what their risks are, family history. And so I'm not saying hormone pellets are terrible for everyone. They're a little bit more nuanced, require a little bit more oversight. And so you want to work with a provider that gives you the full menu of options. If you had a partial hysterectomy, how do you even know if you're in menopause? Well, I'm going to tell you, it doesn't matter. There are ways that we can tell. There are labs that we can run. But guess what? If you're struggling with symptoms and we test your sex hormones and you don't have any, I'm not going to say no hormone replacement therapy until you've gone through menopause, right? Because research is showing that not only is it beneficial for reversing symptoms, but it also helps protect your health as you continue to age.
All right, we made it to the fifth hormone imbalance. This is vitamin D deficiency, and we call this the shadow metabolizer. You wake up stiff every morning. Your joints ache, your knees, your hips, your lower back. Getting out of bed requires a mental pep talk. Standing up from a chair makes you groan involuntarily like someone twice your age. The fatigue is constant, but it's a different type of exhaustion than you felt with cortisol dysregulation. This feels heavier, harder to shake, especially in the winter. The dark gray days make everything else seem worse. Your mood is flat, your energy is non existent. You catch every cold that goes around, and the strange rash on your arm won't go away. Your migraines have gotten worse, but these symptoms seem too random, unconnected, too vague to mention to your doctor. If this sounds familiar, you're dealing with the fifth and final hormone imbalance, the one that we call the shadow imbalance, because it works quietly in the background, making every other hormone imbalance worse while creating its own constellation of vague, easily dismissed symptoms. You're what we call the shadow metabolizer. And this term captures exactly what's happening in your body. This is a hormone deficiency that's operating in the shadows, lurking behind all your other symptoms and amplifying every other imbalance, making it harder to fix.
So I hate that it's called vitamin D because it's actually not a vitamin. It's a major hormone regulator. In order for something to be considered a vitamin, your body can't synthesize it, right? But you can actually synthesize your own vitamin D and store it. So it's not a vitamin. And insurance will pay for lab testing for vitamin D, and there's a prescription to treat it that insurance will cover, right? And so it's really not a vitamin. If I had a fancier name to it, people would take it more seriously. But vitamin D makes all of the other hormones operate better. It actually will optimize things significantly. And research shows that when you have optimal levels of vitamin D, you have a lower risk of heart attack, stroke, osteoporosis, and inflammation. It actually is the number one missed diagnosis of postpartum depression because it's a major mood regulator as well, and it helps you be able to control your weight. And so we'll talk about this a little bit later on, but there is a wide range of normal that, your vitamin D can fall into. So you may have gone to your doctor and they said, "Oh, my vitamin D is fine. It's normal." So we'll talk about what that actually looks like. But who is at the greatest risk for developing vitamin D deficiency? Well, if you live in a higher altitude, if you have snowy winter months, if you have heard the term seasonal affective disorder, where you feel depressed in the winter, you're at risk because you're not out in the sun, right? You're not exposed to it. And I don't know about you, but even in the summer, I'm wearing sunscreen. I'm protecting my body because I'm fair. I don't want to get, skin cancer. And so as we get older, our skin becomes more thin and easily damaged, and we have less collagen, which means that we don't convert vitamin D as easily as we did when we were younger. Also, if you have darker skin, you have melanin that will block that production of vitamin D. And so if you are a darker skinned woman that lives in a snowy in Chicago, right, that is going through perimenopause and has decreases in collagen, there is a high likelihood that you have vitamin D deficiency. The good news is that it's easy to correct, but the bad news is that you have to know exactly what your optimal levels are and you have to recheck it. So if you've already gone through menopause, you can still get help. Vitamin D can be treated at any time, as can most of these deficiencies and imbalances. And if you have a history of heart disease, you really have to optimize your vitamin D levels to protect your body. How much vitamin D should you take? It's a question we commonly get. And the answer is it depends. If your vitamin D levels are too low, then you need to optimize it and you do a higher protocol. If your vitamin D levels just need to go up a little bit, or you're maintaining, then that's a different level for you as well. But I will say that vitamin D has to be taken with vitamin K to prevent hardening of the arteries. And if you also take it with magnesium, or you get enough magnesium in your diet, which most of us don't, that will be able to help you store it and absorb it really, really well.
So let's tie all this together. As we talk about the 5 hormone imbalances, I want you to know that hormones really operate more in a hierarchy. Insulin and cortisol are at the top of the food chain. They're the ones that we talked about first, and they are impacting all the other imbalances down the food chain. We have to then optimize our thyroid in order to optimize our sex hormones as well. And vitamin D is really that regulator that we talked about that's going to make everything worse, or on the other hand, make everything better. So as we talk about hormones, think about a symphony. There are different musical instruments that are playing, and we have to all be playing the same music. Our instruments have to be in tune. We have to be going to the same beat, because when one is offbeat or out of tune, it's going to mess up the entire performance. So your hormones work together. And this is why we can't just focus on one hormone imbalance. We have to optimize all 5 of them. And this is where so many get it wrong. When we just focus on sex hormones, that's at the very bottom of the food chain. We have to optimize all 5 imbalances to really get the best results. So as we bring this back together, and I talked about my story, how I'm a nutritionist, I owned a gym, I watched women in their 20s and in their 40s get different results. And then I learned about hormone imbalances. I learned how to optimize hormone health. And before Sarah and I came together, I was running my own natural health practice where I was testing hormones. I was doing natural strategies, focusing on nutrition and fitness and herbs and supplements, and helping so many women balance out their hormones. But then I hit a screeching halt in my own life again, where I couldn't fix myself. I knew all the right things to do. I knew how to eat. I knew how to exercise. I knew what my labs needed to look like. I knew all the natural strategies that I could do. But I found myself in a circumstance where I was experiencing secondary infertility, having multiple miscarriages. My thyroid was not optimized. I was told my labs were normal, but I was feeling terrible. I couldn't sleep through the night. My anxiety was so high. I was experiencing night sweats. I was having brain fog, cold intolerance. My hair was thinning out. I knew something was wrong in my body, and I did all the natural things that I knew how to do to increase those levels with herbs and supplements. And I did make some traction with that. So maybe you're listening to this and you're thinking about all of the natural things that you've been working on or that you want to do. And I'm here to just share with you that sometimes the natural things alone are not enough to move the needle. And really, what my body needed was to have some of those hormones replaced at that time. I needed to increase my progesterone levels more than any amount of herbs I could take would do. I needed bioidentical hormone replacement therapy. My thyroid, I had undiagnosed Hashimoto's disease, and I needed to have some support there. I needed to lower inflammation in my body. I needed to have armor thyroid come into the picture before my body was really optimized, on top of focusing on all the hormone imbalances at the same time. So sometimes natural things alone are not enough, and we need to marry that with prescriptions as well to ultimately get results. Our body is interconnected. Our hormones are interconnected. Our thyroid, our adrenals, our ovaries as women, they're all talking to one another. And think about it like a three-legged stool. If one of the stool legs breaks, then we're going to wobble and fall, and the body's going to have to compensate through our other hormones. So we can't just focus on one thing. We have to work all five imbalances together. So the problem isn't you, it's been the approach that you've been given, where we focus on siloing one thing at a time and not looking at the body as a whole. So I want to make sure that you know that everything that we've been talking about today is backed in science and research. Here's a couple studies just to point out that these hormones are interconnected in research. We know that whenever we are optimizing sex hormones in relationship with insulin resistance, we get better results. We know that vitamin D is correlated with all of the other hormones. There's thousands of studies that back this up, and you can reference so many of those in our book as well. So if you've gone to your doctor and you've been told that your labs are normal and just to eat less and exercise more, what do we do, Sarah?
Yeah, well, there's a huge difference, and I alluded to this earlier. Huge difference between normal and optimal, because you can feel terrible at one end of normal and amazing when we optimize your levels. And so let's start again with the definition. What is it that defines a normal lab? Well, it takes your labs and compares it to people of your same age demographic, and 95% of the people that have similar labs, that's considered normal. If you're 2.5% above or 2.5% below, that's when it's abnormal. And so I don't know about you, but most women in their 30s, 40s, and 50s with normal labs still feel terrible. And so I don't think that it's okay for us to accept that normal and feeling terrible is just how we're going to feel, because there are so many things that we can do to reverse symptoms and get to optimal levels. So in traditional medicine, we all went into medicine to help people, right? We went in to learn how to improve your quality of life, to save lives. I mean, I worked in trauma and critical care, but in traditional medicine, we are not trained to optimize your labs. We are not trained to reverse chronic diseases. We're trained to help you after you are sick. And so here's one of the top menopause experts in the field right now. She is doing a tremendous job educating people around hormone replacement therapy, specifically, sex hormones. And she has a confession. She said for years, she was not the menopause doctor that her patients needed. She's atop of her game, OBGYN, right? Skilled in many aspects of women's health, pregnancy, surgical care, board certified. But when it came to menopause, she didn't have any comprehensive training. She didn't have evidence-based knowledge, because guess what? 20 years ago, when she finished her education, was when the health initiative came out. And so she had no treatment options. And so they didn't tell her about menopause. They also don't tell about nutrition and the complex needs of changing women's bodies, right? And so she and I were together a couple months ago. We had dinner and we talked about also how in the traditional medical model, we're not trained on supplements, we're not trained in nutrition, we're not trained in fitness. We're trained to treat you after you get sick. And so going back to vitamin D, the normal level of vitamin D is 30 to 100. But if you look at the research and you want that cardiovascular protection, you want to prevent osteoporosis, you want to prevent dementia and decrease inflammation, your vitamin D level has to be at least 60. And for our women, we love it to be in the 80s, right? That's the hormone harmony level right there. But in traditional medicine, we don't do that. If you fall within that range of normal, we say, oh, you're fine. And so even top menopause experts are only treating sex hormone imbalance. They're also still missing huge pieces of the puzzle by not optimizing vitamin D, insulin resistance, thyroid optimization, and supporting the adrenal gland. And so many people will then turn to functional medicine, but functional medicine is also limited. And so in functional medicine, they are often not traditional medical providers. They could be chiropractors, they could be nutritionists, and there's no problem with that. It's wonderful, but they can't prescribe things to your local pharmacy, right? They can't order prescription medications, order traditional labs through your insurance, and they often don't accept insurance either. And so we're trying all of these different things and complicated testing and supplement protocols, right? When sometimes we need all of the tools in the toolbox, right? We need help with everything. And so as women, we don't feel well. We're spinning our wheels. We're trying diet after diet. We're wasting money trying to build our own treatment team when it's really not that complicated. So, Abby, I guess we're just doomed to feel this way forever, right? There's no hope.
No, we don't want you to feel that way, but we also want to be honest with you and share the truth of what it's going to take to be able to create a different outcome. So the definition of insanity is doing the same thing over and over again and expecting the same result. And what we see so often when we're trying to lose weight is that women come in, the beginning of the year in January, they're determined to lose weight. And by March, they're starving themselves, they're working out, but they're not getting any results. And so maybe by late spring in April, we're going to our doctor and we're saying, hey, something's off in my body. I'm doing the right things. I'm eating less. I'm exercising more, but I'm not losing weight. And your doctor maybe tests your labs for you, but they're normal, like we just talked about. So you're left again with resorting to the same old habits of trying a different diet. And then by, summer, we want to feel good in a swimsuit. We want to be on vacation and be confident in photos. So we're starving ourselves. We're doing something extreme, but we're still not getting the results. So by the fall in October, we throw in the towel and we give up because the holidays are here and we're determined that we'll try again in the new year. So here's the problem. This is a broken approach. Whenever we're doing the same thing that we've been doing before and listening to this advice, like we've been sharing with you, women are not small men. We can't do the same things as men and follow the same, research that's been done only on men. We need to start doing something different. And we also can't just approach one hormone imbalance. We can't just take thyroid medication and expect everything else to fall into place. We can't just start hormone replacement therapy or just take a GLP-1 or maybe just start working with a nutritionist or a personal trainer and try a supplement that we saw online. We need to get to root cause medicine. And what we mean by that is think about a plant that you've seen outside or even a weed in the ground. There's leaves outside that you can see above ground, but then there's roots buried deep. And if we just pluck the leaves off of the plant or the weed, it's going to grow back because the roots are still embedded. And what's been feeding that to begin with is still going to be feeding it. So what are those root causes? They're the 5 hormone imbalances that we were talking about. It's the thyroid dysfunction, it's the cortisol dysregulation, it's the insulin resistance, it's sex hormone imbalances, and it's not optimizing vitamin D. When we get to the root of the issues of all the things that happen because of those hormone changes, and we actually heal the reason, well, weight loss can become a natural byproduct because weight gain is really just a symptom of the underlying issue. Your body wants to release weight when it's in balance. So this is what we've done. We do the matrix method where we put all of these pieces of the puzzle together. We use targeted supplementation off of your own data where we're doing your blood lab testing, we're doing DNA testing, we're seeing what your unique body needs and how it's been wired. We use medical teams and nutrition teams together to bridge the gaps so that we have no tool off the table. Everything is based on your own unique data, which is the most important part of the puzzle because this is not a cookie cutter solution. Every woman is going to go through menopause, but every woman's experience and the imbalances that happen because of that are going to be different. So you need an individualized approach. So if you haven't grabbed a copy of our book, we go in depth on all of these imbalances, and a great place to start is here. But if you're interested in taking the next step forward in your health, taking things to the next level, actually getting your own data tested and getting a personalized plan based off of your symptoms, your health history, your data, your goals, the next best step is to actually book a health intake appointment with our team. We're going to be able to personalize a plan for you and walk this journey alongside you.
And so we've done this with over 2,000 women. We start with data, we start with your medical intake appointment, and women like Milana. So maybe you're coming to us because, she had her son's wedding in a couple months and she said, look, I know my health has gotten away from me. I've been really busy, but you know what? I want to show up and enjoy the wedding day. I don't want to feel embarrassed in photos. And so here's a photo of her at her son's wedding, super excited to get her picture taken. And she said in her own words, like, she didn't didn't realize that she had lost her confidence. She said her dress fits, the weight loss is a bonus, but feeling and looking healthy is the true reward. And we gave her all of the tools to be able to do that. And then there's Tracy, who came to us, and she was a lifelong athlete. She's actually coaching a high school field hockey team, but she was diagnosed with Hashimoto's that was completely not controlled at all. She had her thyroid antibodies into the 900s. We like it to be less than 10. She had inflammation all throughout her body, had seen traditional medicine, rheumatologists, functional medicine, and came to us on 19 supplements. And also, she continued to gain weight. She was following a very strict autoimmune protocol. She was working out consistently and was just terrified to take the plunge. But here she is. She's a mother, a wife, a grandmother, a teacher, a field hockey coach, a fitness fanatic. She's always been disciplined. And when she had that diagnosis of the autoimmune disorder, it took her 7 years of complications and symptoms. But here she is. I mean, she lost 50 pounds with working with our team, feels so much better, and is back out on that field hockey field playing with her students. And then there's Julie, who is like one of our dearest case studies. We actually have her as her own chapter in the book as a case study of how we put all of this together. But Julie, a year prior to finding us, she said in her own words that she was literally suicidal. She had gone through 2 years of cancer treatment that had worn her down. She had osteoporosis from chemotherapy, had 4 fractured vertebrae in her back, and had no cartilage in either knee. She had to have knee replacements and was 50 pounds overweight. So do you think that she's able to go out and exercise? No, she needs a customized plan. And more so, she had her oncologist place her on a medication called letrozole and told her that weight loss was impossible. And he's never seen it. She shouldn't even bother with it. Within 90 days, she was down 30 pounds. And now within 6 months, she is down back to her goal weight, had lost 50 pounds. And in her own words, she learned so much from the education and the support of the team. And she was just so grateful. But this photo says it all because she went from suicidal to planning a baby shower for the coming of her first grandchild, showing up 50 pounds less, feeling so much better as the best version of herself. And taking it one step further, when she went back to her oncologist, he said, "This is incredible. In 20 years of practicing oncology, I have never seen anyone lose even 5 pounds on letrozole, let alone 50. I need to get in touch with these providers." And so he refers people to us. He uses our protocols in his clinic, and we're making a movement and a change for many, many women, even without using hormone replacement therapy. And so it's not just the women that I mentioned today. You can go to Google reviews. Our name of our company is Vitality Health Matrix. We have way over 76 now, but these are all 5-star reviews, giving not just 5 stars and see you later. They are paragraphs of saying exactly how their lives were changed, sharing before and after photos, how it impacted their relationships, how they got their health back on track and they regained their confidence, and so many more things, more than just number on the scale, right? They reclaimed their health, they knew what to do, and they become empowered, which is why we call the book Empowered Weight Loss, because it gives you all of the tools. And within the book, we actually have our hormone protocols, we have our optimal lab levels. We tell you what we do with our patients and put it all together for you so that you can actually get some answers and results as well. And so I always say that health insurance here in the US is like car insurance. It's there after you get sick. And so I've been paying car insurance my entire life, but not once has it gotten me a better vehicle. If I want a car that's not going to strand me on the side of the road, that's going to get me safely places with my children at 2 a.m., I need to invest in just a safe, reliable vehicle. And our health insurance is the same way. It's great for, if you have something happen where you have a hospitalization, you don't go bankrupt, right? You can rely on your health insurance, but it's not going to help you optimize your labs. It's not going to pay for supplements. It's not going to pay for a gym membership or Whole Foods. If you want a better body and if you want to restore your health, you do need to invest in that beyond health insurance and not wait until after you get sick and your body is damaged.
We want a different timeline for you. And if you've spent the time listening to this whole time and understanding what's going on in your body, then let's make a different plan together. And that starts with different decisions. So what if, you started and you jumped in with your own labs, your own data, and you had a targeted approach of supplements and medications that could actually optimize your hormone levels? And what if in 4 weeks, the scale was already moving and symptoms were resolving for you? And at that 3-month mark, you were down 20 pounds and feeling great, sleeping through the night, having the energy to do the things you love with the people you love in your life. What if in the summer you were shopping for new clothes and new swimsuits and you were feeling confident in your body on vacation, taking photos? And then what about if you went into fall in the holiday season so confident that you could easily maintain your weight through the holidays? That's the story that we want for you. And if you haven't, like we said, grabbed our book, Empowered Weight Loss, this is going to give you the roadmap of how to get there. But if you are tired of doing this on your own, if you're tired of, spinning your wheels and trying to figure out what to do, or you already know that the providers that you have right now in your life have been telling you your labs are normal or won't do the testing that you're looking for, I invite you to book that health intake appointment with our team. We have experts on our team who are going to walk alongside you. Like we said, this is not just a one siloed approach. We need your medical provider, your nutritionist, your coach, everybody to be speaking the same language, because when we're all in the same boat, rowing in the same direction, we're going to get to our destination faster. And that's how we've helped so many women get results, but not just get results that last, both on the scale and in resolving their symptoms. This takes a team approach and it takes personalizing a plan for you. And that starts with a health intake appointment.